Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about chronic venous insufficiency, or CVI, a condition where leg veins have trouble sending blood back to the heart. This can cause swelling, skin changes, and in severe cases, ulcers. But with early care, symptoms can be managed and complications prevented. To help us talk about why it happens and new treatment options, I'm joined by my colleague, Dr. Bryn Henderson, a board certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being here.
Well, thank you for having me. It's a privilege.
So let's talk about what is chronic venous insufficiency.
Chronic venous insufficiency is a long-term condition where the valves in the leg veins don't work properly. Instead of blood flowing towards the heart, it pools in the legs, and this leads to heaviness, swelling, varicosities or varicose veins, and skin thickening in some cases, open sores that are very slow to heal.
Let's talk about the different types of chronic venous insufficiency and the stages of chronic venous insufficiency.
Well, that's a good way to organize what we're going to go through here. The first is the mild stage, the swelling and heaviness in the legs, especially after standing for long hours. The moderate stage is when there's a development of varicose veins and the skin changes, like darkening or thickening of the skin. And severe stage, the third, is venous ulcers, and they don't heal easily and they risk infection.
So, what are the causes of chronic venous insufficiency?
The main cause, without a doubt, is faulty vein valves. The risk factors include age, family history, obesity, pregnancy, prolonged standing, and previous blood clots. Anything that increases a back pressure is going to cause a weakening of the vein walls and damage the valves.
Do genetics play a role?
Yes, ma'am, they definitely play a role. Chronic venous insufficiency runs in families. Certain inherited traits, like weaker vein walls, for example, or a tendency to form clots, even increase the risk more.
So, how does traditional Chinese medicine look at chronic venous insufficiency?
Well, in traditional Chinese medicine, chronic venous insufficiency often is linked to the key deficiency or blood stasis. This is a disorder viewed by them as out of balance. Treatments include the acupuncture to improve circulation and herbs to strengthen the energy and reduce swelling. While evidence is still limited, many patients report symptom relief when TCM is combined with standard care.
Well, how do you diagnose it in your office?
It starts pretty easily because patients are aware of it usually before you even bring it up. The diagnosis starts with a physical exam. Actually, it probably begins with a history. But if you just look at the legs, you're going to see varicose veins, swelling, or the color of the skin changes. The most useful test is a venous ultrasound, which of course we have in our office, which checks how well blood flows through the veins and whether the valves are leaking.
All right, so standard of care?
The standard includes beginning with compression stockings to support circulation, medications to reduce the swelling and prevent clots, and lifestyle changes like elevating those legs, exercising, and weight control. Procedures such as laser therapy, sclerotherapy, or vein surgery to close or remove damaged veins are also very successful.
So, in your office where there's regenerative medicine going on daily, what are your therapies?
The therapies that are emerging there are being studied, and they're regenerative cells like exosomes that improve blood vessel repair and reducing inflammation. The platelet-rich plasma that is given is often explored for its healing and growth factors. It also creates new blood vessels. This especially helps collateral circulation for venous ulcers. Peptides also support tissue repair and circulation and are being researched and used.
All right, beyond medical treatment, let's talk about lifestyle strategies that can support recovery.
Well, lifestyle's crucial. Stay active, keep walking, elevate those legs, avoid prolonged standing, and maintain a healthy weight and balanced diet.
What's the long-term outlook for these patients?
The long-term outlook is very good if they're disciplined. It's proper care, and most patients can manage their symptoms very well. However, without treatment, the condition gets progressive and goes to ulcers and infection, and that's a bear for people to live with. So it's consistent with management and good outcomes.
So what's your mnemonic?
Veins, VEINS.
And I have very easy. V stands for
Valves that need support, especially those compression stockings.
E.
Exercise and leg elevation.
I.
Infections prevented by skin care.
N.
Nutrition and weight control.
S.
Surgery or sclerotherapy for severe cases.
I want to thank you, Dr. Henderson, for taking us through chronic venous insufficiency, a condition that can impact daily life, but with proper care, patients can find relief. If you or someone you know has leg swelling, heaviness, skin changes, don't ignore them. See your doctor early to prevent complications. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.